I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today, as every opportunity I have, I really appreciate having the chance to talk to you, to have a conversation in which we can talk about health, disease, prevention, and how to keep this body of ours in good shape so it can serve us well for many, many years. We talk about longevity, food, etc. Everything that makes your body work well and enjoy life. That's what it's all about. And today we're going to talk about COVID-19. What? You might be wondering. Are we going to talk about COVID-19? Isn't that awful pandemic just gone to the past, behind us? Why are we going to talk about a health problem that we had, unfortunately, has changed dramatically for the better? Airplanes are flying again, people are working again, attendance to university, to schools is back to normal, and so on. So why do we have to talk about COVID-19? Because unfortunately, the consequences, the aftermath of this epidemic has not left us. It's been 4 years since everything started, since we panicked, closed doors, closed our homes, even to the dearest of the people that we know, to our parents, to our boyfriend, girlfriend, long-time friendships, etc. We just insulated ourselves into a very small cocoon from which we were working and talking and everything, and social media exploded because there was no other way to do things. Online shopping, etc. Our lives changed completely, dramatically. When you think of it, our lives are very different today than what they were in the beginning of 2020. But now it's almost 4 years. And we have to talk about it because at the hospital, as a doctor, when you talk to people in the doctor's office, we keep on seeing a lot of patients that have symptoms that are connected to that infection. So it's not gone. We had about 78 million cases of COVID worldwide. More than 1 million people lost their lives during that pandemic. So to say that it was very serious is really to downplay the real impact that this pandemic had in your life, in my life, in everybody's life. It was very important. So let me tell you something. When I talk to people and I start asking questions, I can almost tell from the beginning that we are going to be talking about COVID. People come with syndromes and symptoms they can hardly explain. They don't know where they came from. They never happened. That didn't happen in their families. In their whole lives, they didn't have a problem. And now, all of a sudden, they have all these symptoms that came out of nowhere, and they can blame anything in particular. And you start doing testing, and you don't find the typical findings that you find in that type of symptomatology. And more, we're reviewing the situation and considering that what you're having, what's happening, is the aftermath, the post-COVID syndrome that medicine has determined to call long haul COVID. Let me explain a little bit about it so we can understand what we're talking about. Viral infections, and COVID is not the exception. Many viral infections, some lung infections, some liver infections, some infections of different parts of the body produced by viruses, can be managed and conquered by immunity mainly, because remember that we do not have an antibiotic for viruses. That's why the pandemic was so bad, because we didn't have a medication. Oh, you have COVID, I'll give you penicillin. You have COVID, oh, I'll operate and take it out of you. No, this was an infection produced by viruses. And viruses are very tricky, very sneaky. And they can produce a lot of damage that's very hard to control. The other part, which is very bad about these type of viruses, is that they can diminish their activity, they can go down a lot in a way that we think we conquered the infection. And you feel well, and you feel strong again, and you want to work, and you want to do a lot of things. That's all right. But two things might linger within your body. One is the virus itself. It's not going to be active, but it's going to be there. And their mere presence is going to develop a subliminal, very small, very everything, whatever you want, but still present inflammatory response from your body. Your body knows that virus shouldn't be there and tries to fight it off. But the viruses, as I told you, are very sneaky. They have a lot of tricks under the sleeve, and they're not going to let the immune system just to come after them. They can hide in the cells. They can hide in the nucleic acids, in the RNA mainly. And it's very hard for the immune system to fight them off. So what's going to happen is you're going to have that virus for a very long time with a subliminal inflammation, with a low degree inflammation that nevertheless is going to produce a lot of symptoms in your body. And that's going to be targeting a lot of things in your body. That's going to be very damaging. And that's what happens. So I want to tell you about it because it is very important. When you have these things, then these antibodies are going to produce a number of substances that produce damage, that produce pain, that produce misfunction. So many organs in your body are not going to be functioning well. And that reflects on symptoms. It's very frequent that all of a sudden we started having neurological or muscle symptoms. We had like fogginess, lack of sleep, problems with a lot of functions. We cannot focus on things. But also we're weak, we're painful, but we could also have heart symptoms, are very frequent. Many people after COVID develop shortness of breath. And they're not the ones they used to be. They say, doctor, I used to walk back and forth and do this. Now I get short of breath. I have to walk slower if I want to do things. And even though it might not be completely incapacitating, it certainly is bothersome. Something is happening in your body that wasn't there before. And you're right. You're right to be worried, and you're right to try to do something about it. And today, at the end of 2023, doctors' offices see a lot of people that come because of all those symptoms they can hardly explain. They cannot sleep well, they had problems with mood, they feel depressed, they have all these symptoms. And when you think of them, all of them are really in the same type of situation. If you have fogginess, if you cannot focus, if you're in bad mood, if you didn't sleep well, if you have pains and aches, if you're short of breath, well, once you start putting all these things together, I can tell you, you're not going to jump off the bed in the morning and say, oh, let's do this and let's do that and let's travel and let's go on hiking, etc. You're not going to feel like that. So quality of life starts to go down. If that's you, if that's what you're experiencing after COVID, even it happened 4 years ago, 3 years ago, 2 years ago, you might have a long haul COVID syndrome. And you have to get information, educate yourself, and learn how you can overcome this problem. Because you're not the same. You're not enjoying life as you did. And in many cases, symptoms might be very, very simple, like a persistent cough, which is again very frequent. People that tell me, doctor, ever since the COVID-19, I have this cough that just there. Why? Because we know this virus, one of the organs where it can hide in is the lungs. So if you have that, you have a little inflammation in your lungs all the time, in your bronchial tree, and that produces a very low degree but bothersome cough. You don't need that in your life. And it could be in your liver, and I told you, very importantly, in the nervous system, in the muscle system, and in the heart and vascular systems. And they're very important because they limit your life. They incapacitate you. And even though you can do a lot of things, you're not the same one you used to be. That's why it's very important that we pay attention to that you follow this program careful. And if you can share it with other people that you know might be having the same symptoms, they're going to be grateful. I'm going to be grateful. So stay with me. We're going to talk about COVID-19 at the end of 2023. You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today, we're having this conversation, as we have them every now and then, talking about health issues, or diseases, or health problems. And today, I'm taking the opportunity to talk to you because I want to discuss COVID. And I said it before. How can we be talking about COVID at the end of 2023? And the main reason is because it hasn't left us, unfortunately. COVID it's gone, we don't see it anymore, we see very little problems, they're not what they used to be. COVID is not killing anybody today. Remember, it killed more than 100 million people only 4 years ago. Yet, it's with us. I'm a doctor, I go to the hospital every day, I see patients, I talk to people, I talk to other doctors, and I can tell you that COVID-19 is still with us. Because we have something that we have called long COVID syndrome. This is a number of series of symptoms and problems that are connected. The onset is connected to the pandemic of COVID-19. We had COVID-19. It might have been a serious illness. I might have gone to the hospital. I might have been in intensive care unit, or it might have been a very mild, simple COVID, as many people fortunately had. Nevertheless, the fact that the virus became very active in your body is going to leave, it's not a scar, it's going to leave an viral activity within the body. Because viruses, we don't have a treatment for them. Take a look at the common flu. You have common flu and they tell you go to bed, have chicken soup, a couple of aspirins, call me in the morning, right? Why? Because we don't have a treatment. If it were a different type of an infection, the doctor might be telling you, I'm going to give you an antibiotic to fight it off. I'm going to give you this antibiotic, I'm going to give you this anti-inflammatory, I'm going to give you, and that's going to work. But with viruses, they will never tell you that. And common flu is a very good example. We don't have a treatment for it. You get it, you have to live with it. You have to let it go through the normal cycle. You have to wait for your immune system to start fighting it off. And then, only after the immune system starts to work is when the symptoms start to go down, because the virus is going to be conquered, so to speak. But we said it before, I'm going to repeat it. Viruses have a lot of tricks under the sleeve. They're sneaky, they can hide in any part of the body, and unfortunately they're so good at disguising or hiding that they can even parasite the RNA, the nucleic acids in the body, in the cell. The only way to kill them is to go and kill the cell. We cannot do that. So what happens? What happens is the virus is there, and even though it's not producing any disease, its mere presence elicits an inflammatory reaction. COVID was a very inflammatory disease. Very inflammatory disease. It killed people because it got inflammation everywhere in the body, from head to toe. If you have COVID, you can remember that everything hurt, that everything was in bad shape. And if you had a severe one, if you went to a hospital because of that, well, people had conjunctivitis in the eyes, had sores in the mouth, they had problems with the bladder and urination, they had inflammation in the lungs, in the liver, in the heart, in every single part of the body. It was a very inflammatory disease. And it had a very dramatic impact on people's lives. Because all that inflammation can produce a lot of problems. And one of the biggest problems is that some of the inflammatory responses had to do with the ability of the blood to transfer oxygen. So people were literally being asphyxiated, even though lungs were working. The lungs were working, but we couldn't deliver oxygen to the blood. And then, of course, the body demanded more and more. And the way the body does get more oxygen is by increasing the heart rate, by increasing the respiratory rate, and people were panting and were with a very heavy and very active heart beating, etc., to no avail. Because the problem was not that you were not breathing. The problem was that the oxygen couldn't get to the red blood cells. So we had a huge lack of oxygen. And by trying to breathe more and more and more frequent, we gave people oxygen to at least improve the situation a little bit. And it was so heavy, the need for oxygen, that people ended dying because of fatigue. The effort to breathe was so big that there was a point, a breaking point, where you didn't have any strength left to breathe. You just give up and you succumb to the disease. That's why they were using respirators, to help people breathe with less effort. But even in those cases, it didn't work for them, unfortunately. So we had more than 1 million people dying because of this terrible inflammatory disease. And it was inflamed the liver, the spleen, the kidneys, the bladder, your mouth, every single mucosa, your eyes. It was really a terrible attack from this virus. So it's not surprising, or should not be surprising, that once the virus left us, just a tiny presence of the virus can elicit a chronic inflammatory response. And that chronic inflammatory response is going to be affecting some organs more than the others. Some of those organs are your brain, your nervous system, the muscles. So fogginess, headaches, migraines, all these things are very common in people that had COVID and that still have a long COVID syndrome. So they just don't feel well. The mood has been affected. There are many things that are not where they should be. The other one is the heart. A very common syndrome is shortness of breath with lack of physical activity as they used to have it. It's not that you used to hike or climb the Mount Everest or anything like that. It's just that your daily routine of walking around the block or going shopping or anything will demand that you stop every now and then to catch your breath. Things you didn't do before. Just walking from your car to the shopping mall or walking within the mall is going to make you short of breath. That is your heart. Your heart is not getting the strength, the stamina it used to have. So we have to keep inflammation as one of the main culprits of everything that we're suffering after this. And inflammation, to make it worse, it's with us. It's part of our daily life. Our lifestyles, our lack of sunlight, our lack of good nutrition, we're chronically inflamed. Even if you didn't have COVID, even if you don't have long-haul COVID, we are chronically inflamed. Inflammation is probably one of the most important factors affecting health in today's America. You can look around. People have a lot of symptoms. People are achy, are swollen. I mean, just look at people's faces. You can see the lines, you can see a lot of things. And not because they're getting old, it's because they are swollen. And swelling and inflammation bring pain. So even though you're not hurting, you have discomfort. You have problems starting to move. You might wake up with a stiffness in your joints. You might not move as fast or as well as you used to. Well, you have that picture. Put on top the reaction to a virus that has nested within our very own cells. There are going to be a lot of symptoms that are going to be robbing quality of life. So what do we have to do? Why are we talking today? Because if we understand, if we educate ourselves, if we get all this knowledge, you might start already thinking of what you have to do to beat the problem. And that's the reason I want to talk to you. That's the reason I'm grateful for you to listen and to follow me. And if you have any more questions, you know you can contact me on the social media of your choice, and on the telephone. You have a toll-free line, you have an email. You have to contact me, because I think already many of you are starting to visualize that we will have very good answers for the problem. So don't go anywhere. Let's continue talking. You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. We're having this conversation about COVID-19. 4 years after the beginning of the pandemic, well, we're discovering that it hasn't really left us. That many people have a very important group of symptoms and feelings that are not pleasant, that are not helping the quality of their lives, and that have to be fought, have to be corrected, have to be changed. Because if not, the quality of our life is not going to ever come back to the quality we had before. If we cannot sleep, if we're in bad mood, if we're depressed, if we have aches and pains, if we're short of breath when we do minimal things that we used to do successfully, then our life is not what it used to be. So something is happening. And what's happening, we have said it, we have explained it, is the presence of virus still within our body that have not been destroyed, we have not been able to get rid of them completely, that produce and elicit a low degree but ever-present inflammatory response. And that's going to give us a lot of problems. I was saying also that if you add to that our lifestyles, well, we begin to create the perfect storm. Why do I have to mention lifestyle? Because lifestyle has to do with everything. Lifestyle is how you treat your body. What time you go to bed, what time you go and exercise, what time of physical activity you develop during the day, what type of food, what type of water, what quantities, how much sunlight, etc., etc., etc. Everything revolves around lifestyle. And to wonder what does lifestyle have to do with health would be as silly as to wonder what do the type of roads, what did the type of fuel, what did the type of things I do to my car have to do with it aging? If it's dirty, it's because we dirtied it. We took it to bad roads with mud and everything, that's why it's dirty. If you open it and then everything is worn, it's because we didn't clean it, we didn't keep it, we didn't guard it from damage. If it's making noises and so forth, it's because we're using cheap fuel, or because we're not using lubrication or the right lubrication, right? That's lifestyle. Our bodies respond when we treat them well. Same as our cars. When we change the spare plugs, when you change the air filters, when you change the oil, when you use good fuel, when you make sure that your tires are well aligned and balanced and everything, your car runs fine. Same as your body. Now, there are two things that we learn about with COVID. And one of them, and the first one, was vitamin D. In the worst part of the epidemic, a group of people in Italy, working with people that died, they failed to respond to the pandemic. They were dead. One of the things that they did is see why did they die. They wanted to know. Why did they die? And checked everything and went through a lot of things. And very soon they came with a very, very important report. People that die had very low levels of vitamin D. D as in David. And that vitamin D level, as low as it was creating a lot of problems for people. And then they jumped to the other side of the fence and said, how is the vitamin D on people that did very well, that went through COVID very well, got the infection, fought it well, etc. They had very good levels of vitamin D. And of course, because one thing that you have to know, once for all, is that for some unfortunate reason, we call it vitamin. But vitamin D is not a vitamin. It is a hormone that has very important activities in the body. And one of them is being an anti-inflammatory. If we have established that COVID-19 was a highly inflammatory syndrome, systemic inflammation in the body, anything that could bring down inflammation, would help you to go through the disease in a successful way. If you didn't have the vitamin D, the hormone D, at good level, then your defense against that inflammation was going to be diminished, you were handicapped, and you were going to have a very serious disease or succumb to the disease, as many people did. So we learn about vitamin D. And that was very good because it has changed a lot of things. Because now you can go to the laboratory and the same way you want to check your sugar in the blood, you can say, I want to check my vitamin D. And it's more important because if your vitamin D level is low, you can buy for pennies vitamin D supplement and give it to your body. And many people say, but I eat well, I do things. No, don't think that way, because it doesn't work that well, unfortunately. Number one, you have to eat very well to have a good vitamin D level. And the other one is that as we age, the ability of our body to make vitamin D goes down. So as we get older is when we need more vitamin D. Not only that, but a lot of symptoms associated to aging, like loss of balance, loss of equilibrium, loss of muscle strength, are due to lack of vitamin D. Call me, contact me. We can talk a lot about it, and I can tell you ways to solve the problem, and you have to go no further than your local store, general store, because vitamin D now it's sold everywhere. The other one and this is even more important, is we rediscovered a substance that we knew about, which is serotonin. Serotonin is called the happiness chemical and so forth because it handles a lot of the problems with the neurological function. It connects one neurological cell to the next. It produces a lot of things that help us a lot. It produces melatonin, which is the hormone that produces sleep and let us rest, but it also produces a sense of well-being and happiness. However, serotonin is only made 10% in the brain, where it has the most obvious actions. But 90% is in the gut. And the serotonin is, again, a hormone, not only a mediator. It works like a hormone that can trigger an absolutely fantastic immune response. It can help inflammation too. So if we have this, we have to make sure we have serotonin. We have good levels of serotonin. How is serotonin produced? Well, it's produced in the gut thanks to the intestinal flora. If we don't take care of our gut, we don't have serotonin. That's why many people that have intestinal problems are depressed, are in bad mood, cannot sleep, they have a lot of disorders because of serotonin. Serotonin is a very important product that the body can make it if it's given the chance. Serotonin handles a lot of the digestive functions. Have you ever eaten something that didn't agree with you? You say, I ate something, didn't agree with me. I felt bad and I vomited. I felt bad and then I had diarrhea. What happened? Your body wants to get rid of that. You put a poison in your body wants to get rid of that. It has to throw it up. It couldn't be clearer than that. You throw it up, or it has to be excreted the other end. Who does that? Serotonin. Serotonin in your gut, as a hormone, can tell that this thing you ate is not good for you. It's a poison, it's a toxic. Has to get out of that and produces a big release of serotonin into the intestinal tract that in turn is to make it react and empty one way or empty the other. But take that thing out of the body. And all of you have lived through it, I'm sure. You have this discomfort, you don't feel well, and we know it, we say it's something that I ate. I went to this place and ate this thing. And the minute I took it, it didn't agree with me. That's serotonin again. It's detecting something that you don't like. And then you get nauseous because serotonin starts to be released and telling the gut, let's move this thing out of the body. And when it is very dramatic, then you throw it up or you excrete it on the other end. All that is serotonin. But once again, it also is going to give you good sleep, good mood, feeling well. But for that, you need a healthy gut. And you're not going to get it on French fries, hamburgers, or box cereal. Even if the cereal says it has fiber. You're not. Follow me. Follow a lot. I have a lot of good advice. Or call me. Or send me a message in the social media of your choice. We have a toll-free number. Call me. I can help you because you can change your life. It's within reach. It's in your hands. Let's finish this, but don't go. We have another chapter to talk. Hi, how are you? You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And we have been talking about COVID. 4 years after the beginning of the pandemic, we have to talk about COVID. We have to update what we have learned, what we know, and what's happening to us. Because COVID has not left us. We have the long-haul COVID syndrome that affects many people. Many people. I don't have numbers, but I can tell you that a huge percentage of people that had COVID still live with something that has been left as a very unfortunate reminder that we had COVID. It is, I don't know, tens of symptoms, and all of them bothersome, all of them affecting quality of life. If we have diminished strength and stamina, if we have aches and pains, if we have inflammation of our joints, we have abdominal discomfort, if we have shortness of breath, and problems with our hearts. Many people have even problems with the rhythm of the heart. They have to go to the cardiologist because all of a sudden they start feeling extra beats or problems or palpitations, and they have to check with the cardiologist. If we cannot sleep well, if we're in bad mood, if we don't feel like doing anything, if we get tired very soon, if we have headaches, all of these might be connected to COVID activity. And all those symptoms have been produced by a lingering, not very obvious, but ever-present of inflammation. And that inflammation, we know, produces damage to each and every part of the body, to each and every organ of the body. And we have to fight it off. We have to try to get rid of it. We have to go against it. So shortly after COVID, we started looking at people with these problems, people that came to me and said, "Doctor, I had COVID, and yes, it wasn't very serious, but after that I'm short of breath, I have headaches, I cannot function the same way, I have to go to sleep at 11 o'clock in the morning, I don't feel well." And we were looking at more and more and more people, and sure enough, the medical literature started showing a lot of cases. So the important thing is, okay, with everything we know, we have talked about inflammation, we have talked about serotonin, we have talked about vitamin D, we have talked about lack of oxygenation in the systems, etc., etc. We have talked a lot of that. Now you say, what are we going to do? And the obvious answer is, let's backtrack on everything that I have said. If we have inflammation, let's go for anti-inflammatory strategies. If I have aches and pains, let's reduce swelling of the organs. If I have digestive system problems, well, let's review what we're doing with our intestinal gut, with our diet, with our food, with our fiber, and so on. We have to backtrack to go back to where we were in the beginning of the pandemic. And that is exactly the program that we have implemented at the hospital. And you don't have to be seriously ill. You just have to have this syndrome that is blocking part of the efficiency of your daily life. It's not like you say, I cannot function anymore, I cannot do anymore. You might be living your life, working, even traveling, doing a lot of things, but you're not having the stamina, the performance you used to have. Well, that's time to implement a good program. Sometimes a good supplementation might be good, a good dietary planning might be good, and all those things can help. In that case, Again, you can communicate with me and say, doctor, I have these problems. What could I do? Where should I go? Should I check with my cardiologist? Should I check with who? I'll be happy to guide you. But if you want to put things in the good or in the best perspective possible and gain a lot, I really, from the bottom of my heart, if I could do it, I would tell you, go right ahead and do it, is take a break. Give your body the chance to recuperate by doing a BioCare health getaway. Because if you come to BioCare, this is not the regular hospital. You're not going to be in a hospital ward. You're not going to be doing a lot of things you do in a regular hospital. You're going to be working for yourself. You're going to be working for your health. And when we see people at BioCare, we start with a very good medical history. We're going to go through every part of your life. Not only your diseases, but also what you do with your life. How you live, what you eat, what times you eat. Can you keep a regular schedule? Can you follow up on good things to eat? Do you have to travel a lot and just eat on the go? Do you have to barely sleep because you jump from one place to the other or from one plane to the other and changing time zones, etc.? We're going to explore all your life to see how we can plan, to have a better plan for your life. We're going to review your flora, your intestinal flora. We're going to look at the health of your gut. Because believe me, the health of your gut has to do with every single function of your body. Remember, we have talked about serotonin. 90% of that serotonin is in the gut's mucosa. There has to be a reason. We have to trust somebody's wisdom for having that serotonin in our gut. And not only we have to protect it, we have to improve it by eating the foods that will increase it, by creating the intestinal flora that's going to produce it. And that you can do at BioCare. Because not only we're going to review everything, not are going to analyze it, but we're going to plant the type of flora that your body really needs and probably is lacking. We're going to make sure that this is well fed, because the intestinal flora, like every organ in the body, needs to be fed. You're going to give prebiotics, you're going to give fiber, you're going to help this very important organ, which is the intestinal flora, to work well and on our behalf. And that's going to reduce inflammation. That's going to improve immunity. That's going to help every single part of the function of the body. We're going to be working with oxygen. We're going to be working with hyperbaric oxygen, with ozone, with different forms of oxidative therapies that are going to help you. Even the infusion of glucose in the blood at the same time that oxygen is given through a nasal tube can reduce inflammation and kill viruses in the body, which is the culprit of the syndrome that you're suffering with. So every day you're going to get a treatment like this, where not only you're doing your hyperbaric oxygen, but you're using oxygen with glucose in blood at the same time to improve the damage of the viruses that are in the cells. And everything is going to start changing. You're going to see, and I always ask my patients, make a selfie every day. And you're going to see day by day how your complexion improves, how the lines of your face smooth, And 2, 3, 4 days into the treatment, you're going to wake up and you're going to say, I slept so well. I feel rested. I slept so well that I feel with energy. And then you get out of bed and you can have a positive outlook of life because your serotonin, your dopamine are beginning to work again to the levels they should be. And food, which is going to be a very important part, believe me, this is probably the only kitchen in the world where you have all the doctors on staff looking after the type of produce, products, and cooking. We use long times to cook, we use quality food, we make sure you have a very fantastic, beautiful food that's good for you. Because I want you to have a dinner as if you were in a restaurant. But I want you to eat quality food that's going to improve the health of your body. This is going to be a vacation. A vacation in which every day you're going to feel better, function better, and gain something. This is not a vacation where you're going to need a vacation after the vacation because you're bloated, you're sick, you're tired, you're everything. You're going to go back home feeling completely different. And I tell my patients, I tell people that come here, I say, don't take it from me. When you go back to the office, when you go back home, when you go back to your relatives, people are going to tell you, what did you do? Because you look great. Because being healthy is being beautiful. There cannot be beauty without health, unless it's artificial or fake. But you don't want that. And that's going to give you better quality of life, better enjoyment of life, and survival with quality of life. Till next time, I am Dr. Rodrigo Rodriguez, BioCare Hospital.